In this procedure, we'll be placing Ultra Plus Nudicles in a Weimaraner. The Nudicle is pre-sterilized. We have the Weimaraner prepped as a normal castration procedure. We'll make an incision, a pre-scrotal incision, and then we will remove each testicle separately and then put the testicle in the tunic that the testicle came out of. So the procedure right now, we have the skin incision done, and now we're making the tunic incision to remove the testicle. This is identical to an open castration, and the only difference is we're going to then put the nudicle back into the tunic. We try to keep the skin incision fairly small so it allows for a little quicker healing, a little less irritation. And the difference between this one and the second testicle, in this one, this was the first procedure that we had done using this, and it's a little bit easier if the incision in the tunic is made a little more cranially. It allows a little more room to put the nudicle in and then hold it in place. In this procedure, the dog was a little older, and the attachment of the epididymis to the caudal aspect of the tunic was a little more firm than I expected, so we had to use sharp dissection to break that down. We used 2-O-monocryl in this case, but we like that instead of a gut because of less chance of suture reaction, and this is a procedure we'd prefer not to have any suture reaction going on. In a normal open tunic castration, this is the procedure, and the tunic and the procedure would be done as soon as we remove the testicle. We do a normal double clamp procedure and then make sure we don't have a bleeder. Because we're closing the tunic back up again, it's pretty important to make sure that your ligature was strong and in the proper position. Now what we're going to be doing is we will be putting a drop or two of penicillin on the nudicle. One, it allows it to be a little more slippery to put into the tunic, and supposedly it will decrease the chance for infection. When we're putting this in, it's very helpful to have a second person in the surgical procedure. And what we do is that way you just have somebody holding on to the tunic so that the implant fits in a little bit easier. Being that this was the first one of these that we had ever done, we weren't quite sure on the placement. However, as you watch this go on, as we do the second testicle, it's dramatically faster. But what we noticed the first time was we had a little difficulty getting the testicle in. And this is where the cranial incision helps a little bit more because it allows you to have a pocket to put the testicle in. We were concerned that the testicles were a little larger, that the implant was larger. The measurement was fairly close, and this dog was right in between two different size nudicles. And the owner opted for the larger nudicle. So we weren't quite sure if we were going to get it to fit properly, but as it turned out, it fit in just fine. And on closure, everything came out just beautifully with this dog. It's been about a year since the surgery. We've seen the dog multiple times since then. The owner's extremely happy, and the dog is happy too. So that was the issue right there, was to have somebody hold it closed as you start to suture. When we suture this, we again use 2-O-monocryl, and we will place the 2-O-monocryl in a continuous pattern across the tunics. The initial suture I anchor with a cruciate pattern. One, it will close the tunic a little bit faster that way at the start, and I was concerned about the integrity of the tunic and the strength of the hold. But as you watch the suture pattern go through this, you'll see that the tunic is incredibly strong, and the fear that the tunic is going to tear as you suture it is just ungrounded. And you can see as I'm pulling that there's no tear at all in the tunic. It's an extremely easy surgery to perform. Once the testicle is removed, there's just no problem putting this in. The new Ultra Plus has an epididymis that slides down into the tunic and has a perfect positioning for it, so it actually helps keep the testicle in proper position all by itself. But as you can see, as this is placed, there really isn't any room for the testicle to slide around, and the chance that they're going to be in an abnormal position postoperatively is pretty marginal. And that you can see both of them in place, it's very difficult to tell which one is the implant and which one is not the implant. So then we continue the procedure to the second testicle, and then as we do the second testicle, you will note that the incision is made a little more cranial to facilitate the implant being placed. And in this testicle, as we remove it, there was no attempt to manually break down the epididymis contact with the tunic. We just opened it and cut it with scissors. And it was a lot quicker and a lot easier to do. And as long as you stay close to the epididymis, there's no damage of tearing the tunic, but I suspect if the tunic was cut at that point, a simple suture to close that would be no consequence for the entire procedure. At this point, we compare the size of the testicle and the nudicle, and you can see that the testicle is just a little bit smaller body-wise, but if the epididymis is on there, it's about the same size as the nudicle. Again, this was a choice of the owner to go just to a little bit next larger size. Makes the surgery a fairly tight fit for the nudicle, but the pressure on the tunic is not enough to damage the tunic, not enough to compromise the integrity of the surgery, or enough to stretch the tunic to cause necrosis. Off the camera, we're putting the penicillin on the nudicle again before we place it inside the tunic. This is where the other hand is really helpful to open the tunic up. But you'll see that this fits in the tunic much, much easier than on the first side. So remember, make a cranial incision in about the cranial third, and it allows very, very easy placement of the implant or the nudicle in. If this is an Ultra Plus nudicle with an epididymis, again, that will be placed in after we put the nudicle in first, and then the epididymis goes down the sheath. And there's plenty of room inside the tunics for the epididymis to go cranial. And you can see in this one also that the cruciate pattern for the first suture closes it up very nicely, so you don't have to keep constant pressure on the vaginal tunics to keep the testicle in place. Closure of the tunic is completed, and the testicle and tunic will then be replaced. We close with a subcutaneous suture pattern. We'll again use 2-0 monocryl for this. Without skin sutures, you have less irritation, and with a subcuticular pattern, the dogs just seem to leave it alone a lot more. So it's really rare that we have any postoperative licking or postoperative complications. And as we close, we'll take a deep bite into the fascia, not real deep, but into the fascia, just to ablate any dead space between the two sides as we close. Postoperatively, no discomfort at all. The dog did just fine. And in a Weimaraner, their thighs are fairly tight in these guys, and their testicles tend to go cranial and caudal to each other. And literally after surgery, they were in a completely normal position as he woke up. No, we were concerned that he might lick posteriorly because there's something there, but I have a feeling that the feeling to the dog is that nothing's been done postoperatively. We use pain management before and after surgery, and he did very, very well, was very active, no edema, no swelling, no problems at all. We bury the suture to the fascia also, so that when the knot is buried underneath the skin without a problem, and very, very normal appearance postoperatively.